we are going to move into our first presentation. And I'd like to introduce you to Dan Heim. Dan is the Executive Vice President of LeadingAge New York. And LeadingAge has been part of this Elder Law Forum almost from the very beginning. It was then the New York State Association of Homes and Services for the Aging, NIASA, and Carl Young was one of our panelists on several occasions. Dan has been with us on several occasions as well, and he's going to fill us in. And LeadingAge, he'll tell you, represents a lot of the providers that are working their way through the COVID-19 crisis and working their way through the rest of the challenging issues that face us in senior housing in today's marketplace. So with that, I'm going to turn it over to Dan.
Thanks, Lou. Good morning, everyone. Very hard to believe that this is the 25th version of the Elder Law Forum. You could probably say that Lou and I and some of the other folks have been aging in place for a long time here, but anyway, I'm greatly appreciative to Pierro, Connor, and Strauss for once again putting this on and for inviting us to be a part of this panel. So today, what I want to talk about is how nursing homes, assisted living, and retirement housing are dealing with COVID-19. And there's a lot to talk about, but of course we have limited time. So you do have my presentation. I'm going to give a little kind of intro and level setting in the beginning. I'll talk about measures being taken to prevent the spread, some challenges to protecting residents and staff, keeping residents and families engaged throughout this very difficult time, and then what we can do to prevent a resurgence of this illness, this virus, as we begin to reopen the economy. So in terms of just some level setting, the folks that we're talking about here in nursing homes, ACFs, assisted living, and retirement housing, these individuals are predominantly over the age of 65, and we know from the CDC that age 65 plus is a major risk factor in COVID-19 becoming, a much more difficult circumstance medically and clinically. And there are certain contributing conditions like lung disease, diabetes, heart disease, and hypertension that place an individual at greater risk of having more adverse outcomes from COVID-19. And as it turns out, there's a pretty high prevalence of these risk factors in these populations. Lung disease and diabetes and heart disease, up to 1 in 3 residents of nursing homes and assisted living have these conditions. Hypertension is much more common. Up to 3 in 4 residents suffer from hypertension. So we're dealing with a population that has a lot of built-in risk due to these factors. So nursing homes and ACF assisted living are doing a lot of things to try to prevent the spread of this virus, as well as to care for people who have contracted it. Most of these are the result of directives of the CDC, the Centers for Medicare and Medicaid Services, and the Department of Health. And you've seen and heard about most of these. And really, restricting visitation has been really one of the most painful decisions that's had to have been made. And many of us have folks who are in these facilities. My uncle recently tested positive and lives in a nursing home. So we all kind of are feeling this separation. And I'll talk later on about some of the kind of creative things that have emerged to try to keep families and residents engaged. But requiring use of personal protective equipment, enhanced cleaning procedures, screening staff when they come into work, and then every 12 hours for COVID symptoms, and also taking temperatures. And we'll talk as well about actual staff testing, which is going on as well. Restricting group activities and congregate dining, trying to separate out residents who are positive from those who are not and staff them separately. And then finally, as I alluded to earlier, testing of both residents and employees. Now, retirement housing facilities or independent senior living, they're not regulated as healthcare providers, but they are taking several steps. And some of these are required by New York on pause, things like suspending group activities and group transportation. closing restaurants and beauty salons and barbershops. And most of these communities many of them are doing food deliveries right to residents' rooms or grab and go type of accommodations. Screening staff and contractors who are coming in the buildings, really trying to discourage visitation. And again, this is independent living, so you really have to try to strike a balance there. And it's not a healthcare facility, but trying to discourage people from coming in. Also enhance cleaning, and instead of in-person tours, doing much more virtual touring, and then quarantining residents for 14 days after they move in. And then finally, practicing social distancing and wearing face covers. So some of the challenges that providers are seeing in terms of keeping residents and staff protected, among them are, and these are kind of the most prominent ones, access to enough personal protective equipment. So this issue, as it turns out, is much bigger than long-term care. It involves the entire healthcare system, first responders, and many other industries. And we simply have had we've had huge demand, and on the supply side, lots of difficulty there with creating enough supply and adequate distribution. And certainly if you're a facility that has active cases, your rate of usage can go up very suddenly. So when you think you have enough inventory, you may not, as it turns out. And initially, nursing homes and ACF assisted living were not prioritized in the distribution of these supplies. That's beginning to change, and things are starting to get a little better, but we're really not out of the woods yet. Access to testing continues to be a big concern. The CDC is recommending that staff and residents be tested on a kind of a one-time baseline and then periodically thereafter. CMS is now recommending testing of residents as well. And like personal protective equipment, we've had a lot of demand, and we haven't had enough supply of the testing materials as well as the capacity of the labs to process those tests. Adding to all the pressure here, the state, many of you have probably heard, they recently ordered that all nursing home and ACF AL workers, and it should say workers, not residents, be tested 2 times a week. So this could really put a strain on our testing capacity. That's 80,000 tests per week that would have to occur, about 3 times the level that's being done now. We're concerned about it being a hardship on the staff. These tests are not very fun to go through, and certainly if staff have to travel to get to a testing site, that is very difficult for them. Many of them are single parents and caregivers themselves, and it's a financial burden as well. We estimate it will cost $44 million a week just for nursing home and ACFAL workers to be tested. So it's a lot of money and a lot of time and a lot of effort. And this really kind of feeds into the third major challenge, which is the financial impact we're seeing on providers. Lots of increased costs due to staffing, and there's a lot of staff who are out because of the illness. Those people have to be backfilled, and meanwhile, those individuals are often on paid benefit time. And we're seeing reduced census in the facilities as well because, as you probably know, elective surgeries in hospitals up until very recently have been completely on hold. So many of the Medicare and other cases that would be coming into these facilities haven't been coming. And of course, there's some sentinel effects from the pandemic as well, and people are staying at home longer because they frankly are afraid to go into a congregate setting. So lots going on, lots of challenges to talk about. And one of the challenges, and I alluded to it earlier, is trying to keep residents and families engaged during a really unprecedented and difficult time. And recently, both the state and federal governments have begun to require nursing homes, and in the case of the state government, ACFs, to notify families and next of kin of deaths from COVID or positive COVID cases that are occurring in those facilities within 24 hours. In the case of the federal standard, it's within 12 hours. And how you do this is a real balancing act because you want to keep people informed, but on the other hand, you don't want to incite panic and fear and concern. So you really have to try to strike a balance there. And I've identified on the slide here just kind of several initiatives that facilities are taking to try to keep residents and families engaged with each other and with the facility. And I'll mention a few others as well. We've heard of social work and activities workers taking photos of residents and sending them to families, and then the families in turn will share pictures of them with the residents. We've seen a lot of facilities use their in-house TV channels to do a lot of programming and connecting with residents, which has been very helpful. In assisted living, we've heard of meals being served in hallways so that residents can be spaced out, but they can still see and talk with each other. And specialized approaches for those residents who have dementia, and there really is an added difficulty when individuals have dementia because of mask use and lots of other factors. So I think the bottom line in a lot of these interventions is that, at least I believe anyway, many of these will endure after the pandemic. In many cases, families and residents are separated by distance and other factors. And I think we've seen a lot of creativity emerge during this period, and a lot of these programs likely will continue in the future. And that kind of brings me into the final part of the presentation here, which is how do we prevent a resurgence in these facilities of coronavirus as we begin to reopen the economy? So with respect to nursing homes and assisted living and ACFs, there's really no indication from New York State yet on relaxing visitor restrictions or group activities. We would expect that these would be occurring in the last phase, which is phase 4 of the reopening. So we expect it's going to be several weeks, if not months, before some of these things can happen. Now, the Centers for Medicare and Medicaid Services recently issued a plan. It was actually May 18th, earlier this week, on how to reopen nursing homes. And they're going to be looking at several criteria, including the number of cases in the community, the prevalence of cases in nursing homes, staffing levels, access to adequate testing, which we talked about as well as adequate PPE, and having enough hospital capacity in the local area. So we've begun to kind of dig into those recommendations. But again, given the vulnerability of that population, we think it will be some time before we see this happening in the state. The CDC has issued reopening guidance as well, which would affect retirement housing. And so that's an area that we'll talk about in a moment. And the state and federal governments in the meantime continue to focus in laser-like on infection control. There are specialized surveys that are going on to make sure that facilities are taking all the steps that they can to contain the spread of this virus. And then, of course, I mentioned testing and PPE, and lots to talk about there, lots going on trying to improve that situation. In the realm of retirement housing, as I mentioned earlier, these facilities are not regulated as healthcare, but they are subject to New York on pause. We are now in phase 1 in this area and most of upstate. The salons, the beauty salons, barbershops, and restaurant services are not going to be opening until phase 2 and phase 3 respectively. And the timing of those will be dictated by what happens at the local level in terms of several factors that are being reviewed. And the CDC I mentioned earlier has reopening guidance that will provide recommendations on when things should happen in retirement housing and other settings. And as it turns out, retirement housing communities have begun planning efforts already for future lifting of visitor limitations in group activities and also things like tours. But you know, here in New York, we're behind many other states in terms of the progress of our reopening. So we're going to take this opportunity and our members to learn from other states in terms of how they're navigating some of these issues. As I mentioned earlier, folks in retirement housing, many of them are over the age of 65 and have underlying medical conditions. So we want to exercise care and caution as we reopen. So with that, Lou, thanks very much, and look forward to Q&A later on.
Thanks, Dan. And Dan, we've talked about this, but over 25 years, the housing market for seniors and people with disabilities has changed dramatically, yet nursing homes remain the provider of those that are the most chronically ill. And the people working in those nursing homes go to work every day with a very, very difficult mission. They've taken heat, and the nursing homes have taken heat. But really, those people are part of the heroes that have brought us through this pandemic.
They absolutely are, and one of the things that our association is doing is collecting some of those stories of those heroes, and we're making that known. A nurse in a nursing home or a nurse in assisted living, in our view, is very much a hero as a nurse in a hospital or a clinic. So we're making that known to the world.
So if you have questions for Dan, you can put them in on the right side of your screen. There's a place where you can chat with us, and we will take those questions and hopefully have time at the end of the presentation to take some of those questions for all of our panelists. At this point, we're going to move on to some of the new initiatives and new ideas in senior housing. And I'm going to introduce to you Duncan Barrett. And Duncan has spent his career developing, preserving affordable housing with a number of projects currently in develop in New York that combine senior housing with volunteering, and as we'll see, with an intergenerational component. So we're going to bring Duncan on, and there he is. And Duncan, if you can advance those slides to get to your deck. One more. And you're on. Thank you, Duncan.
Good morning. Thank you, Lou. Let me give a little context on this project that I'm going to present to you this morning, and the genesis of it, and then I'll explain the aspirational nature as well as some of the specifics of the program and physical design. Beacon Communities is a long-term owner, developer, manager, operator of affordable and mixed income housing, and we currently own and operate about 19,000 units of housing in 11 states, including 11,000 plus units that are senior or senior and disabled housing. So we share the challenges of other housing operators in this pandemic, and I'm really appreciative of hearing LeadingAge's explanation of the challenges we all face. The aspiration of this project is to create an intentional, supportive community that services multiple populations who can assist each other through community and through volunteerism to lead better, more fulfilling lives. Specifically, senior citizens, older persons, and families who are adopting or have adopted or fostering foster children, and adults with intellectual and developmental disabilities who are able to live independently in a supportive community. Those three populations will be housed at this site. The site is in suburban Albany County in the town of Guilderland, and it is a result of a 3-year planning effort on the part of the New York State Office of Children and Family Services, Northern Rivers, which is a regional not-for-profit service agency, the Center for Disability Services, and others, including the Department for the Aging and Beacon Communities. Beacon Communities was invited by the task force that Children and Family Services organized to join this effort locally because we had previously partnered in Western Massachusetts with the Treehouse Foundation to build and operate a similar community. That community, known as the Treehouse, has operated for 13 years and has had some very successful outcomes. So rather than follow the order of my slides, I'm going to speak for a moment, if I could, about the benefits of this intergenerational community. First, the benefits for older adults. And these benefits were measured by the Treehouse Foundation. This project in Guilderland is inspired by the Treehouse model. Treehouse pioneered in Massachusetts and now in California and other places, I believe, this model. And we are building on the successes and the learnings that Beacon and Treehouse went through in Massachusetts. But the benefits to the older adults have been life satisfaction, and these are reported through surveys. So they're self-reported by the seniors. I'll point that out. But enhanced life satisfaction, a greater quality of life, higher self-esteem, and as reported by the site staff, a successful aging in process. We have a number of seniors who are still living in our facility who are in their 90s. We have virtually no, and the facility has been in existence for over 13 years.
Duncan, Duncan, I apologize to interrupt you. We do seem to have an issue with your syncing of your slides. Currently, we're seeing the location slide. Is that the slide you want to be on?
Yes, it's fine. I'm really not speaking in the same order as the slides. So
thank you very much.
Yeah, thank you for the clarification, for permitting that. And very few of our residents, if any, have actually transitioned to nursing home care, which we treat as a successful outcome. So the seniors who are really volunteers in this facility have benefited. The foster kids and the foster system, I've had foster children myself. The foster children in this facility have benefited greatly. The foster care system is in many ways broken. I'm sure some of you know that. But the rates of high school graduation, the rates of intersection with the criminal justice system, teen parenting, failed foster care placements, and attendance at college or vocational school are all remarkably improved outcomes over what happens nationally and in New York State, frankly, in foster care. And then the fostering parents or the adoptive parents are also benefiting because they're being provided support services by our seniors, transportation, tutoring, mentoring, respite for the foster family from the day-to-day care of children who may have had a fairly troubled earlier life, meals, after school care and observation. And so that's the intent. The community in Guilderland, I'm going to flip backwards through the slides now to get to the plan. The community in Guilderland will be 65 units on, as I said, a suburban site. It is located adjacent to the town of Guilderland's library and across the street from a regional YMCA that has a large recreational and athletic set of facilities, and adjacent to Mercy Care nursing home, which is operated by St. Peter's. We are in the process. We've facility. We've gone through the town planning processes and are about to finalize the project financing. We hope to start construction either late this year or early next year, and complete it the following year for occupancy. This is one of several such projects that the Office of Children and Family Services hopes to promote within New York State. We have another site in Broome County and one in Saratoga County that we are pursuing for similar kinds of projects in subsequent years as well. And the community itself is intended to be low-rise, very residential in scale, with the senior population, the family population, and the IDD population integrated, meaning they will be mixed across the site and not segregated on the site, and with a large, robust clubhouse, community center, if you will, where tutoring programs, the weekly community meal, and other support services programs will go on to the benefit of the several populations on this site. And I just say these are pictures at the end that I just put up of the Treehouse community, which is in East Hampton, which is north of Springfield in Massachusetts. This has been a very successful effort on the part of Treehouse and Beacon to provide both engagements for the seniors and volunteer opportunities, but also very positive outcomes for the fostering families and their foster children.
Duncan, we have about 2 minutes.
Sure. And in closing, I would say that this community, the residents of this community will be largely self-selecting. So this is not an environment that every senior citizen will find appealing, but we've been working through the local approval process, the zoning approval process for a while, and we've got a number of calls from people who are retired, including former college classmates of mine, who find the notion of having an engaged life at post-work interesting and appealing to them. And so we're really excited about completing this project and looking forward to a ribbon cutting and a new community in Guilderland that supports both older persons and families. Thank you all.
Thanks, Duncan. And we have a lot of clients that come to us without family, and some call them solo seniors. I don't like the name elder orphans, but that's another name that's been used to describe this group.
Mm-hmm.
AARP has done some studies on it, and they estimate that of the senior population, about 30% don't have any close family or immediate contacts. And we run into issues trying to find people to serve as their powers of attorney, healthcare proxies.
Mm-hmm.
I literally have clients in tears because they don't have any extended family. This seems like a perfect fit for that individual.
It is, and not every individual, senior individual living at the Western Massachusetts project is a younger senior, fit and able. Many of them are with their own needs. And I would say in our affordable senior population, we own 2 other facilities that are within a couple of miles of where this property is going to be built. Many of those people are living with us, but without the support of family, at least local family.
Yeah, so we not only have foster children, but foster grandparents. And I think
yes, exactly.
innovation in housing is absolutely essential. And this pairs groups that I think have no natural connection to family and gives them an extended family that I think could be extremely valuable to them.
I think to both parties, exactly. We believe that, and we're pursuing that. Thank you.
Thank you. So again, if you have questions for Duncan, make sure you put them in the chat. We are assembling the questions. We'll have a little time at the end of the presentation to do that. And we're now going to turn it over to Ken Harris. And let me find Ken's starting slide. Here we go. Ken is the executive director of the Albany Guardian Society. Many of you know the Guardian Society. They do tremendous work in the community. And we're going to hear about some of the innovations that the Guardian Society is working on. Take it away, Ken.
Thank you, Lou. Today, I'm going to talk about 3 innovative ways that seniors are staying in their homes while maintaining their independence. The first is the Village Movement that started 20 years ago in Boston by a group of seniors that formed a nonprofit organization to arrange for services and coordinate social activities. The second model I'll talk about is a senior co-housing model that started in Denmark in the late 1960s and is here in the United States now. And the third is the shared housing model, where nonprofit organizations assist in matching seniors to other seniors or caregivers to reduce household costs and increase independence. While the pandemic seems like it's been lasting for years, it's only been 8 weeks since New York was on pause and went into effect, and Matilda's law directed seniors 70 and over to stay at home. Many seniors found it difficult to obtain food, medications, or find transportation to attend critical doctor's appointments. So, what saved many seniors in this crisis is neighbors helping neighbors to get over what was a very, very difficult situation. And that's what the Village Movement is all about. So the Village Movement is really neighbors helping neighbors. They are geographically defined. So that means that they're either in a small neighborhood, it could be a county, it could be a township, but there's a geographic boundary associated with villages. They are grassroots and they're volunteer based. So it's usually formed, it's a 501c3 and it is formed by seniors themselves and run by seniors. They coordinate programs and activities which really help in preventing isolation, which we all know is a very serious problem in our community. They usually assist with transportation and find the gaps in the services that are already in the community. They sometimes assist with household chores, and they provide connections to the neighborhood and the community. Villages are self-governing, they're self-supporting, they're grassroots, and they're membership-based organizations. They coordinate and consolidate services for their membership. They create strategic partners with existing agencies and develop community resources that don't duplicate the services. That's a really important part of the village construct, is that they're working with existing programs and supporting and finding the gaps of services that aren't there and supporting the agencies that are. And if you've seen one village, you really have seen one village, because they all are set up differently. Villages have to decide when they're starting up, are they going to be all volunteer, or are they going to have some staff? Some villages do have some staff. How are they going to recruit volunteers? Is it going to be social focused, or are they going to be delivery focused, or both? How much will dues be, and who their community partners are going to be? There are various models of the Village Movement. There's the grassroots not-for-profit village model. This is how it started, Beacon Hill Village in 2001. It just was a group of people that decided that they wanted to age in place. They wanted to stay in their home. And they were very smart. They set up a 501c3 with a board of directors, and they hired staff. That was the first model of staffed village. And they were very successful. The New York Times got a hold of the concept, and it really took off from there. Currently, there are about 200 villages in the, one second. Sorry about that. There are about 200 villages in the Capital District or across the nation, and there's more to come up. A second is the agency-sponsored village. Now, this is where there's already a 501c3, an agency that is in place, and villages become a separate partnership, and they become a separate branch of that agency. So really, the first one, the most common one, is where they are a 501c3. The second one is where the village becomes part of an existing agency. The third one is a hub and spoke, and hub and spoke is it's a village where a village has become successful, and they want to expand the village into the surrounding areas. So a village, as I said before, it has geographic boundaries, and some people on the outside of that boundary want to be part of the village. So instead of expanding villages, they have a spoke of that existing village and use economies of scale to expand. And then there's a hybrid village model that has a little mix of all three. 501c3, why a 501c3? Collects dues for membership. That it provides the construct in New York State to be able to collect dues. Allows for partnerships and grants, has tax benefits and product discounts, including for like Google Phone and TechSoup through a not-for-profit. It offers a board of directors for decision making, and it allows for a way to develop a budget and governance for the village itself. Okay, volunteer-based, very important. It's really the thrust of the village. It screens volunteers, provides background checks, driver's records. About half of the village members themselves are volunteers of the village. So it's not just all about receiving the services. People join the village also to give services and to support their community. And other volunteers include retirees, business owners, college students. A lot of people from the community are volunteers in the village. Startup costs are many, and it includes, of course, incorporation. Insurance is the biggest cost, about $3,000 a year to insure the drivers, people coming into their home, the whole the construct of the village. So membership dues and outside income is really needed. Also for event costs, website development, marketing materials, computers, and of course, if there's staff, that doubles the cost. Membership dues range from $20 a year to $1,000, and the budget is anywhere from $3,000, like in Glens Falls, a very low dues village, up to almost $1 million, like a Beacon Hill village. And of course, that all depends on what kind of services you have, how many staff you have. But the average budget is about $130,000, and many over 50% are under 100,000. So really an affordable model for people to start up with a little bit of outside assistance, financial assistance, and dues. Some of the programs: book clubs, concerts, exercise classes, trips to the library, trips to museums. It seems like the old days, just 10 weeks ago, we were doing all these things together, and we will again. But interestingly, a lot of the villages that have formed, we're doing all these things virtually. So it's great to see that villages that have started before the pandemic are really still connecting people when they need it most. Some of the services: home repair, transportation is the #1 service requested, usually for after hours that the transportation locally does not provide, but also transportation to social events, friends, and other places that the current transportation doesn't provide. Medical appointments, friendly visits, computer services, pet care, financial advice. These are all services that villages choose from the menu of services that they can provide for their members, chosen by their members. Some partners include libraries, museums, YMCAs. There's a lot of partnerships that villages connect with, including senior housing and retirement communities are becoming a very important partnership for villages. Coordinating services for members. They not only vet the members, but they vet providers that are contractors that are providing services to their members that may not necessarily If they can't provide the service, the village will look for somebody to provide those services, usually at a discounted price. And so they share those lists and those experiences with each other to try to help people with the more complicated projects that perhaps a village volunteer could not provide. This is an important service that villages give, and often offset some of the cost of the dues by getting a lower cost price for the contractor. The Capital Region Villages Collaborative Albany Guardian Society started this about 3 years ago. We're bringing people together to talk about villages, to educate people on villages. We met at the Carondelet Center every other month in the morning, and we provide breakfast for free, of course. And it's a time for people to network and learn from each other and develop villages. Several villages have come out of people gathering at these meetings over the past 3 years. And it continues to grow. We started with about 4 people. The last meeting we had about 60 people. We have a website, crvillages.org. That website has information not only on the local villages, but the village concept in general. These are the villages that are up and running here in the Capital District. New, Shenendehowa, Clifton Park, neighbors in Northern Columbia County, Bethlehem neighbors, Niskayuna neighbors is our newest village. And then Glens Falls and Rhinebeck are the bookends. They have been around for several years, and they are really helping us out with the collaborative. City of Albany, Guilderland neighbors, and City of Troy are also in discussion for starting a village. So I could see in another 2 to 3 years, there's going to be several villages that are up and running in the Capital District. But underscore that if you're interested, the villages is all about engagement and participation. So these villages are really looking for people to help out and become a member of those villages. crvillages.org. Villages Technical Assistance Center. This is the first technical assistance center in the country that we know of, certainly in the state. It's a collaboration between Albany Guardian Society and the New York State Office for Aging. Greg Olson has been a great supporter of the village movement. It's a 2-year project. The idea is to expand the villages and also provide technical assistance for those villages that are looking to form. And as mentioned before, there's a lot of decisions to make. Are you going to be staffed? How's your business plan? How are your dues? Where are you going to find your budget? What kind of insurance are you going to obtain? These are all the things. We have a project director, Betsy Mulvey, who can help out individually and in group settings for developing villages. There's more information on crvillages.org, but I just wanted to really give a shout out to Greg and to Office for Aging for their great support. The idea is to start here and to scale up statewide for other villages, technical assistance center, other VTECs to expand villages across the state. So I'd like to mention a little bit about co-housing and senior co-housing. This is another model. Co-housing is an intentional community of private homes clustered around a shared space. So it's new build. You purchase the land. You build new houses. The key to co-housing and senior co-housing is that it's architecturally designed to assist with community engagement. So usually there is a main house where activities happen, kind of very similar to what Duncan was talking about with the tree house. But the houses are designed so that people engage with each other, and the cars are usually located on the outside of the community. So very much in support of people coming together by walking and engaging in activities. The community room has laundry, recreational space, and a large kitchen. And the idea is that people volunteer for community dinners on a regular basis, at least once a week. Intentionally limited to about 20 to 40 homes. And this is one of the reasons why there's not a lot of co-housing and senior co-housing in the United States, because it's actually difficult to not only find the land, but to limit the number to 20 to 40. So a lot of the shared spaces being incurred by those members or those residents of the co-housing. The advantage is it does foster internal community and shared mission and values, but purchasing the land and usually run at consensus decision making can be difficult. But the people that do live in senior co-housing, they really love it. Here are some resources that on the slide deck you can find if you want more information. Probably the best place to visit for co-housing is Eco Village in Ithaca. It's a great community, and if you're in the area, I'd recommend taking a tour.
And we have 2 minutes.
Thank you, Lou. Shared housing. This is think modern Golden Girls. This is a construct where a not-for-profit agency is helping to connect seniors with each other. Mostly, it's usually a person who has a larger home that has an extra bedroom or 2, and finds seniors to either for companionship or to defray costs. Sometimes the senior will connect with a caregiver or a student. The best practice in this is the not-for-profit helps owners develop a lease and a shared home share contract. So it is a contract situation, but the concept is really to find a good match for somebody to defray costs and for companionship and security, and to help each other out. So it's really a win-win by finances and support. Here are some resources. There is a shared housing agency in New York, the New York Foundation for Senior Citizens, and Home Share Vermont is another great one, and publication My House, Our House, published in 2013. So the future of senior living is certainly going to involve technology, driving cars, robots, wearables, meal deliveries, medication technology, Alexa, Google Home, smart homes. These are all here. They are all going to be an important part of people remaining independent in their homes, but there's not going to be any substitute for people coming together and neighbors and people helping each other out. And that's what these 3 models, really the foundation, are all about. So thank you, Lou.
Thank you, Ken. If we can have our other 2 panelists come back on. They used to say it takes a village to raise a child, but now it takes a village to care for seniors. The concept is the same. And a lot of what I think used to exist when I remember, I'm old enough to remember neighborhoods where a lot of them were ethnic. So you had a neighborhood of people that kind of organized themselves to provide a lot of these services to the people in their families and in their neighborhoods. Now it's being recreated, it sounds like, and innovation is so key here. Are there any restrictions on village movements, downstate, upstate? Do you see any movement in the city, in the downstate areas in this regard?
Yeah, one of the biggest clusters of villages in Westchester County. They really have, they were the first collaborative, and we actually looked to them to find out their successes and their hurdles of developing. They have about 8 villages in Westchester County, and it's growing. So that's the biggest cluster in New York, and now the Capital District is the 2nd biggest. But the idea is that this would scale up statewide in the next few years.
Fantastic. We do have some questions at this point, and you're going to hear a lovely voice from off camera reading them. Go ahead, Beth.
We have questions for all 3 speakers. But Ken, let's stick with the villages. We have a question. What is the village in the former school in Albany? Are you involved in this? And then where would the Albany village be located?
Oh, yeah, good question. So I think they're talking about Livingston Village. This was the very first village. It was a partnership with Senior Services of Albany. Now it's called LifePath. And it was really innovative. It didn't really work insofar as a village. And there were a couple hurdles. It was actually a tax credit project. And it was the very first one out of the box in our community. And part of the hurdles were just that people didn't understand what the village movement was, and that there wasn't enough funding. This happened about 5 years ago. But I think that they tried to start at the hardest level as having at a tax credit project without a big knowledge. In the past years, we've really scaled up and really see that this model of villages, not only in tax credits or subsidized housing, but also senior housing, they can be great partners, and they have been across the country. So I think it was just ahead of its time.
Okay, well, Ken, we have another question. What are wearables? But while you ponder that, we want to we want to spread it around here. So
Who's got one on his hand? You know, wearables, the iWatch, that is, you know, that's the most common wearable. But there are shirts that can detect, you know, your sweat and biometrics and all kinds of different devices that people actually wear. One of my favorites is GPS sneakers for people with Alzheimer's disease, in case they left their home, that they can, it's something that they wear, they put on their feet, and they can find where somebody is if they go out and they need to be found. So it's really something you wear, but it integrates medical biometrics at the same time.
Greg Olson's going to be with us next Friday, as I mentioned earlier, and Ken, you had alluded to Greg's work. He's expanding that. One of the things that State Office for Aging has done is adopted pets, animatronics, so mechanical pets are being used now in homes. So it's another way that information can be gathered, and that's a pet project of the State Office for Aging we're going to hear about next Friday.
all right, well, we only have 5 minutes to go, so please keep your answers concise. But Duncan, we have one for you. Is the treehouse model workable in metropolitan areas such as New York City?
We believe it is. We are talking to a foster care provider that is located in Manhattan about a project. But the physical configuration will certainly be very different than it would be in Guilderland, New York, or Binghamton, New York.
Okay, and Dan, I've got 2 questions for you. How will the staffing levels be determined in order to meet the CDC reopening guidance?
So, so the question is the CDC reopening guidance and how staff are going to accommodate that?
Mm-hmm.
Yeah, so I think the facility management are going to have to navigate a lot of differing requirements and guidance and recommendations. The CDC, obviously, you know, they have their angle on how you can safely reopen and what that will mean for staff testing and procedures and the like. But there also, of course, is the Centers for Medicare and Medicaid Services, which regulates nursing homes. And then we have the New York State Department of Health. And DOH, as an example, sometimes will exceed CDC guidelines. A good example of that is quarantining of staff when they are tested positive or have symptoms. So it's going to be a challenge, I think, for facilities and for their staff to be able to navigate the requirements of 3 different agencies while trying to keep the staff safe and the residents as well.
All right, this question is for any speaker. Please note, can any speaker address what aging in place looks like in a residence with chronic disabilities or end of life? How is support facilitated and provided?
So this sounds more like an individual home. And I know some of the co-housing things are regular in individual homes. Maybe Ken take a shot at that one?
Yeah, sure. Some of the one of the models that I've come across is it used to be called granny pods, but they're independent living units. And this is a home that's actually a very small home, like a small home that's built next to a family member, but it's also integrated a lot of healthcare systems in it, sometimes Hoyer lifts and other very medical systems that can help people remain independent. Obviously, you know, the aging in place and having universal design features in your home is the first step for people, and would recommend that for anybody that is starting to age in place.
That's been something that a group called the Capital Area Consortium on Aging and Disability pioneered back a number of years ago with Dr. David Hornick. And universal housing is something everyone should be thinking about, but too few people are. We have more questions, but that question is a great segue to our second panel, which is all about bringing care into the home and how to retrofit the home to accommodate the management of chronic illness. So stay tuned for part 2. That's going to be an in-depth discussion of how to treat your own home to make it a place where you can age in place and spend the rest of your life. Beth?
Duncan, how much longer before the community in Guilderland will be available?
Duncan, I think you might be muted.
I was muted. Thank you, Lou. We expect the apartments to be available early in 2021. I'm sorry, early in 2022. I wish early in 2021.
That's a great resource, and it's good to know. Are you good getting out to the elder law community? Because we talk to clients every day that are looking for these kinds of solutions.
And Duncan, how will the integrated housing program be paid for, i.e. subsidized, Medicaid, private pay?
Good question.
These are all independent housing units. So the not-for-profit partners bring with them some forms of state subsidy, either for the foster families or the IDD population, and the state housing programs will subsidize a significant amount of the capital costs of the project, so it won't have a lot of debt service. But there's just an array of small pieces that go into the both the capital stack and the operating subsidy.
So if people did need Medicaid home care, that could certainly be brought in, and there would be no restriction on it.
Yeah.
Right? So you can bring in the whole panoply of services that we're going to talk about in the next segment again. One more. We have time for one more.
One more. Dan, can an ALF refuse to allow a resident to return after a hospitalization or rehab stay?
So, yes, so the question, I think,
Living facility.
I'm sorry?
Just for those that don't know the acronym, assisted living facilities.
Right. So the question, I guess, is rehab stay from a hospital and where somebody can go after a hospitalization. So, of course, COVID is kind of interfering with things a bit now. The protocol now is that before somebody can go into a nursing home from a hospital, they need to have a negative test for COVID-19. We are not aware of any such restriction for an adult care facility or assisted living. So presumably a person could be discharged from a hospital into an ACF or AL. Certainly they can be discharged into the home with home care. But with regard to nursing homes, there are extra precautions being taken now to try to stem the tide of a virus entering into a facility.
Well, gentlemen, thank you. In this COVID-19 era and the pandemic, everyone has new challenges, and we're facing them on a day-to-day basis. We will come through that crisis, and we will get back to some degree of normalcy. And we hope that the 26th annual, you'll be able to join us again and give us updates on how you're progressing with each of these projects.